After you've taken a thorough history of your client, you want to move on to the special orthopedics testing. One of the tests that we do typically with low back pain is called the straight leg raise. If they have any radiating pain going down the buttocks or down the leg, if you can reproduce that by just helping them lift their leg up as they dorsiflex the foot, if that reproduces pain going down the back of the leg, that's usually a pretty good indication that the compression of the nerve is coming from the L4, L5 lumbar spine, which is structurally the weakest part of your spine, and due to all the forward bending that we do, puts a lot of pressure down on that part of the spine. If the symptoms are more centered into their SI joint, then one of the tests is a Faber test, and that stands for flexion, abduction, and external rotation in the hip. So it's a figure 4 position, and you just place one hand on the opposite leg right underneath the ASIS, and then one hand on the inside of the knee. Just push down gently. As you push down, if that reproduces any discomfort in the SI region, that is an indication that they may have some ligament damage or ligament strain. Some of these conditions have a lot of the same symptoms, so the closer you can get to an exact assessment, the faster they can rehabilitate. There's a diagnosis called piriformis syndrome. Feels a lot like sciatica, and if you were to stretch their piriformis or bring them into a side-lying position, when you bring them to a side-lying position, of course that tightens the piriformis, puts pressure down on the sciatic nerve, and it will recreate pain going down the leg. This is really common in runners. It's common because as much as we sit, of course, we're putting a lot of pressure down in that area. So if any of those yield positive results, you know your focus should be on either traction and distraction of the spine in the case of sciatica, or releasing the piriformis or the sciatic ligaments.